Bold just got bolder with HipInsight 2.0. The HipInsight system is the first and only FDA-cleared mixed reality system for hip arthroplasty, and it just got better. HipInsight is now HipInsight 2.0 and offers the following cutting-edge additions and enhancements. Virtual hologram registration with the 2.0 virtual registration tool. Rapid single-point leg length and offset change. Future fluoro images to be compared with C-arm screen during surgery. More Zimmer Biomet implants, including the Z1 femoral stem. Additional Zimmer Biomet instrumentation, including acetabular reamers and the hammer automated impactor. Enhanced revision capabilities, including tri-flange acetabular components. Let's take a quick look at each of these new features. Virtual registration allows the surgeon to superimpose the 3D plan on the patient with minimal physical instrumentation. The fast registration method works by using the virtual registration tool to enter 3 patient-specific points. For the anterior approach, registration can use a surgeon's preferred base point in or around the acetabulum and then touch the operative and contralateral ASIS. Using the virtual registration for lateral position patients is also a quick 3-point method. Virtual registration can be used with any anterior, direct lateral, or posterior approach, including superior, and ABMS techniques. Another feature of HipInsight 2.0 is the ability to assess leg length and offset change using the virtual registration tool. The surgeon records the leg length and offset prior to dislocation and neck cut by touching a single point on the proximal femur. After reduction of the joint with the final broach or definitive femoral stem, the surgeon records the same point again with the patient's leg in the original position. The system will then display the change in leg length and offset. A hologram of the knee and femur can be used to help the surgeon align the leg to the same position. HipInsight's new features can further reduce or even eliminate C-arm use that can potentially speed up cases and minimize radiation exposure to the patient and surgical team. For surgeons who like to assess implant positioning with a C-arm, future fluoro images can validate their implant positioning. Future fluoro images of the planned surgery can be overlaid on the fluoro display during surgery with the Microsoft HoloLens. The predictive images can also be displayed on the HipInsight workstation next to the fluoro screen. The generated images show what a fluoro image should look like according to the preoperative plan. Future fluoro images can be generated for any step of the acetabular portion of the case. C-arm shots of reaming, cup impaction, or the final implant placement can be directly compared to the future fluoro predictive images. For anterior hip surgeons who use intraoperative fluoro, this technique leverages the patient's specific data and flattens it into a series of future fluoro images for use in surgery. These images are distortion-free and generated in a multitude of angles. This allows the surgeon to easily match the C-arm direction. Even if the C-arm is not perfectly positioned, the fluoro shots do not need to be retaken. The HipInsight 2.0 system includes the latest Zimmer Biomet implants and instruments in its planning library and holograms. The Z1 femoral hip stem and other Zimmer Biomet primary and revision implants are now available. ML taper, Wagner cone prosthesis, and Wagner SL revision stems also join the extensive list of Zimmer Biomet implants on the HipInsight system. Holograms for reaming guidance have been added, and the hammer automated impactor too. The HipInsight system is FDA cleared for revision cases, and the 2.0 application continues to advance these solutions. This includes implant and screw planning displays that support complex revisions for multi-hole shells. Surgical Planning Associates also works with Zimmer Biomet's patient-matched implant PMI group to plan and support tri-flange cases. Like primary cases, revision holograms can be sequenced to match the surgeon's workflow. Bone removal, reaming, implant positioning, and screw placement can all be shown. Contact the HipInsight team to learn more about HipInsight 2.0 or to plan a call with your surgeon customer to discuss the features and benefits of the HipInsight mixed reality system.